Okay, please begin.
All right, thank you. And good evening and welcome to the virtual community listening session on mental health and homelessness in West Hollywood. This meeting is hosted jointly by the City of West Hollywood and the LA County Sheriff's Civilian Oversight Commission. This community listening session is designed to lift up community voices. We would like to hear from community members about your experiences with deputies and how you feel about public safety in the City of West Hollywood. Today, we'll hear from panelists discussing law enforcement and homelessness and interactions with people who have mental health conditions, as well as any other public safety issues affecting West Hollywood. You're welcome to provide comments on anything related to the Los Angeles County Sheriff's Department in the City of West Hollywood. Before we hear from you, however, we have a number of panelists who are going to offer some insight. From the LA County Sheriff's Department, Captain John Gannon, Lieutenant Ryan Vienna, as well as Sanjay Shah, a mental health clinical program manager with the LA County Department of Mental Health. Anai Luna from Los Angeles LGBT Center's Transgender Economic Empowerment Project, and Cliff Roberts from Step Up on Second. We also have several other people who are listening to you today. They include colleagues from the Civilian Oversight Commission, Vice Chair Casimiro Tolentino, and Commissioner James P. Harris. From the City of West Hollywood Public Safety Committee, Chair Amanda Laflen and Vice Chair Tory Berger. Sheriff's Department Sergeant Annadennise Briz, Deputy Sergio Venegas, the City of West Hollywood Social Services Manager David Juni, as well as LA County Civilian Sheriff Oversight Commission's Executive Director Brian Williams. When it's time for live comments and the questions portion, as a reminder, you will need to be logged into WebEx. If you're watching on Facebook or listening over the phone, you'll not be able to provide live comments. The WebEx login information can be found on the Commission's website at coc.lacounty.gov. For those logged into WebEx, if you would like to make a comment or ask a question of the panelists, please raise your hand by clicking the small hand icon in the participant window. When the hand is shaded in, you are in queue. We've had a couple of dozen community members pre-register, and we want to be sure to have appropriate time and sufficient time to hear from members of the public. So we will have a timer set for a maximum of 4 minutes per community speaker. Please be respectful of the time to allow for other community members to also express their thoughts. Of course, if you don't speak for the entire 4 minutes, that's fine. But since today's meeting is about community members' voices, we want to allow a little more time than we usually have at our usual commission meetings. After listening to community feedback and conducting research, Commission staff will work with our ad hoc committees to prepare recommendations to the Board of Supervisors, the Sheriff's Department, and the public. As the Commission works to boost transparency and accountability, it is your input which drives the ongoing analyses of the department's policies, practices, and procedures. If you're posting or tweeting during today's town hall, please feel free to tag us on social at LA County COC or at WeHo City. I am happy to be back. We are all happy to be back in West Hollywood once again, even if we're doing it virtually, and hopefully we will be in person sometime soon. With that, I'd like to get started. During your self-introductions, please feel free to announce your preferred pronouns if you'd like to do so. And so we'll begin with my colleague at the Civilian Oversight Commission, Vice Chair Casimiro Tolentino. Please go ahead.
Oh, thank you, Chair Rubin. Well, I'm here to listen. I'm here to learn. Mental health and homelessness are real seminal issues today. The focus today will bring at least into light how to define the issues and possible solutions. I appreciate the community speaking out and sharing their views. Thank you.
Thank you. I don't see Commissioner Harris here yet, so when he joins us, he can add his thoughts. Next up, I'd like to hear briefly from Amanda Laflen, if you would please introduce yourself, and then we'll move on to Vice Chair Tory Berger. Amanda.
Hi, my name is Amanda Laflen. I'm the chair of the Public Safety Commission for the City of West Hollywood. I've been on this Public Safety Commission since 2017. I am really looking forward to this conversation. Mental health and homelessness is definitely a crisis that we feel very deeply in West Hollywood, and coming together for solutions and hearing from the public is a very important part of it's very important for me.
Thank you. And Tory Berger, do you want to add a few words, please?
Yes, I am Vice Chair Tory Berger. I've been on the Public Safety Commission for probably close to 6 years. I've always been very interested in the homeless situation and getting very involved with protecting the homeless, as well as coordinating and complementing them with the community. And when I first started the commission, I went out with the deputies because I like to get right in the trenches to find out what's really going on. And I asked them, what do you spend your most time on? And they said homeless. And I said, how much? And they said about 80% of their time. So from that day on, I really tried to focus a lot of my attention on that. So I'm really happy to be here. I hope that we can find some good solutions.
Thank you so much. And now we'll hear from Chief Gannon from the Sheriff's Department. Please go ahead.
Thank you. It is Captain Gannon. Captain Gannon with the Sheriff's Department. Formally,
right.
I'll take the promotion though.
Captain Gannon, I'm sorry.
I appreciate it. Let me real quickly just explain what MET is for those joining. Mental evaluation teams are MET. It refers to a collaboration between the Sheriff's Department and Department of Mental Health that dates back to 1992 in our county. In this model, it's a specially trained plainclothes deputy sheriff that's partnered with a Department of Mental Health or a DMH clinician. They drive a uniquely equipped, unmarked emergency vehicle. The MET response teams are notified to respond by our sheriff station dispatchers whenever there's a 911 level mental health crisis reported countywide. When the crisis call comes into the MET 24-hour triage help desk, the closest MET team is dispatched from one of our 14 office locations countywide. In addition, we send to our high-risk crises a patrol deputy and supervisor at minimum. The goal is for MET to arrive in time to help positively impact the trajectory of crises that we respond to, such that we can slow things down and we attempt to de-escalate patients and release patrol deputies back to their patrol duties at the earliest opportunity. I just want to pause just for a quick mention. I don't know if you're going to bring up the presentation, but there is a picture that just visually demonstrates what MET is. It'll be the second slide. There it is. Thank you. So we reduce the time that uniformed deputies are on scene in order to help reduce patient trauma, and this also helps to reduce the stigma associated with having the black and white patrol cars on scene during a mental health crisis. MET then conducts their assessment of the patient's needs, and if an involuntary hold is necessary, then MET transports most patients in the uniquely equipped vehicle that we have. We take them to the nearest mental health urgent care facility, an emergency room, or the VA, depending on the patient's status and needs. And in more than 97% of the cases that MET handles, the patient is diverted away from the criminal justice system to receive their mental health treatment. Jail diversion is a significant goal for the MET teams and always has been one of our primary purposes. And the next slide, please. So the next slide will be a visual reference. This demonstrates the amount of specialized training that's provided today to help us with handling mental health incidents for deputies at the different stages in their career. So I'm working from the bottom up. Not shown there, but the baseline is 15 hours of specialized training that all personnel get before transferring to their custody assignment, where they then show up on our chart here and receive 40 hours of de-escalation and mental health training. So that's represented as kind of like the foundation or the building block at the base here. When they go to patrol, their first assignment requires them to attend a 32-hour de-escalation and mental health update training course. We refer to this as the Field Operations Crisis Intervention Training, or FOCUS. And that's the second tier from the bottom. And if they become a field training officer, they continue and get another 8 hours additional training on how to teach others about mental health and how to teach them to engage with people with mental illness. As with all the training that we provide that's shown there, I know it doesn't look like a lot, but that's only because you're seeing it relative to the amount of training in the top three brackets, which are showing MET personnel and the training they go through. Is just to give a visual depiction of how much more. But please recognize that custody patrol and FTO that's shown already exceeds all of the standards required for peace officers in California. Our department provides significantly more training, actually. But you'll notice that new MET deputies and deputies that's been at MET for a year, and especially when a deputy's been at MET for 3 or more years, they receive upwards of 900 hours in formalized instruction and high-level specialized training. This is why MET units are so highly successful in helping to resolve the highest risk mental health crises, and most often the encounters that involve MET result in no use of force being used. So the next slide, please. This is just a slide that I threw in to show a visual depiction of, I would think of MET as like a paramedic responds with the fire truck to the medical aid emergencies. So too is MET the equivalent, but for the mental health emergencies that we respond. And because we're in unmarked vehicles, you may not even recognize that MET is responding to these incidents, but that's more or less what most of our vehicles look like. So whereas it's common to see paramedics countywide, there are just 33 of these MET teams that are available countywide 7 days a week, 24 hours. And so we're covering with 55% coverage about 42 cities now and 120 of our unincorporated areas. And the next slide, please. So in 2018, after realizing a 5-year trend and a 159% increase in high-risk mental health crises locally, the city of West Hollywood decided to take action and improve services that are provided to this very vulnerable population. So beginning with fiscal 2018-19, the city of West Hollywood became our first contract city who works with the Sheriff's Department, the DMH, to provide these contract MET team services now in the city. This helps address underlying issues of mental health, substance use disorders, and especially those that are impacting persons experiencing homelessness. So with that, next you'll hear from Sanjay Shah of the LA County Department of Mental Health. And if you can advance, next slide, thank you.
Thank you, John. Appreciated the opportunity. I am manager for the MET team, and I supervise along with Lieutenant Vienna, the 33 teams plus 1 in West Hollywood MET team. So my presentation is about West Hollywood MET and homelessness. So I started with the data from the LASA. So homeless count organized by Hollywood Forward Coalition in February of 2020 found that 1,513 unhoused people in Hollywood and East Hollywood's 40 tracts. And the Los Angeles Homeless Service Authority counted 1,714 unhoused people in the area of January of 2020. So the number of people living completely exposed decreased by 30%. And this is as per LASA's data. Next slide, please. So West Hollywood, I'm presenting the data on January through April of 2021 because I have a staff who transfer out in May. So that's why I have cut off from January to April only. So in January, we responded to 7 incidents. In February, 24. Then in March, 14 and 12. So total 57 incidents that we responded. They were all adult. None of them were children. Next slide, please. So in January, we hospitalized 2 adult, 5 were not hospitalized. So total, we responded to 7 cases. In February, we hospitalized 10 persons. 14 were not hospitalized and 24 total responses. In March, we responded and hospitalized 10 persons and 4 not hospitalized, so total 14 cases. And in April, we responded to the 6 hospitalization cases and 6 were not hospitalized. So we are talking about total 12 responses. So in all, we responded to 28 hospitalization and 29 non-hospitalization out of 57 cases. Next slide, please. So our population varies from medical emergencies to substance abuse to mental illness to homelessness to all of the above or combination of all. So we have to take into account the medical aspect of the person's history. So we hospitalized 2 persons in an emergency room, which constitute 4%. Inpatient hospitalization happened at 22%. These are the acute psych hospitalization we are talking about. So 39% of them were in a psych hospital hospitalized, and 29 were not hospitalized because they were not meeting criteria for danger to self or danger to other or gravely disabled. So there are a total of 51% not hospitalized, and 4% were taken to the urgent care center for the mental health in nature, so total 7%. So that constituted total 57 responses. Now, the did not meet criteria means maybe sometimes the person is being taken to the police custody or either transported to ER for medical clearance, or may have referred to the drug and alcohol rehab program or social services agency, or some of them were referred to the homeless shelters. Next slide, please. So we also track the data based on homelessness of a person we respond to. So in January, we responded to the 5 homeless personnel and then 2 not homeless, and total 7. We had 11 homeless in February and 12 not homeless. 1 was unable to access, so that totally 24. We had 7 homeless in March and 3 were not homeless. So 4 we were unable to assess, so total 14. April, we had 6 homeless person and 5 not homeless and 1 unable to assess, so total 12. So that constituted total 57. So we are talking about 29 persons were homeless and 22 were not homeless and 6 we were unable to assess. Next slide, please. So we also look at the race and breakdown of the race in terms of our responses in MET. So we have African American 8 total incidents, so total 14% of total responses. We had Chinese ethnicity with 3 number of incidents, so 5% of the incidences. We have other Hispanic and other Latino, 3 total incidents, so that makes 5%. And 27 incidents were not reported in terms of the ethnicity, so that constitute 47, which is major chunk. We have Caucasian as a 16 total incidents, so total 28% of the incidences reported in West Hollywood. Next slide, please. We also track the data by the sexual orientations or the sex of the person. So we had major responses to male. So we had 25 males that we responded to, so total 43% of them. We had 15 female we responded in by MET, that constitute 26%. We had female to male 2, so total 4%, male to female 2, so 4%, non-binary 1, 2%, and transgender non-binary 1, so 2%. And then 11 incident had no sex reported in our data, so that constituted 19%, so total 57 incidents. Next slide, please. We also tracked the database on high utilizers, but we had no high utilizers, at least from the DMH services point of view. So that's why it did not reflect any high utilizer. High utilizers means the people who have been hospitalized 2 or more times and, repeated calls coming to the MET. West Hollywood did also outreach, consultation, and briefing in the community. That's one of the things they provide services. So West Hollywood Met outreach to 54 unhoused individuals and distributed care kits, which are basically supplied by our public safety department. And that becomes a point of engagement for them, with these homeless folks. They know every person's by name and their history. So, we take pride in how they outreach to everybody on the benches, outside the businesses, and everywhere else. Consultation and assistance provided to the homeless outreach and mobile engagement team, which is our DMH specialized team. We also work with Step Up on Seconds, LGBTQI, as well as Veterans Peer Access Network, WASH, and the PATH. PATH is basically providing, services to the homeless on 17 times in all. West Hollywood Met also provides station briefing to total 34 deputies on various mental health issues. So they start their day with the briefing. Because of the COVID, the number of briefings were less, but still, we were able to provide services in person to them. Participated in homeless collaborations with LASA, United Way, Service Area 4 and 5, homeless outreach and mobile engagement team, with total 49 participants. Next slide, please.
Mr. Shah, excuse me.
Sure.
We have other speakers that we need to hear from. So if
Sure.
you could wrap this up.
No problem. So we had a success story. I just wanted to point it out very quickly that we had an elderly gentleman who was disoriented and defecated on the sidewalk and only able to provide his name and date of birth, who was a veteran but did not know what branch. So our staff was able to place this individual and recognize this person and identify the person, that he was living in an assisted living facility in the Hollywood area, and he was a decorated Vietnam veteran and placed in a LM guest home, where he has been now wearing a life alert and provided services, who was diagnosed with dementia and had a history of wandering history. So next slide, and I think it is Lieutenant Vienna.
Madam Chair, just to make sure on time, I know the Sheriff's Department's ran over. I probably have 2 minutes. I could run through this. Is that okay?
Please, I just wanted to give each of the speakers enough time to speak. And as long as you're up, I actually had a question or a clarification for Captain Gannon, but perhaps you can answer it. There certainly was a reference to the fact that Met has a contract with West Hollywood. So my question is, are there dedicated Met teams to West Hollywood, or does West Hollywood just have to take from the rest of the pool? I think that's an important question. So you can answer that. Thank you.
Yes, ma'am. So I'm Lieutenant Ryan Vienna. I am Captain Gannon's successor here at the Community Partnerships Bureau following his promotion to Community Colleges Bureau. To answer your question, the answer is yes, the team is dedicated. Deputy Venegas, he's on the line with us, and he is routinely deployed to West Hollywood and solely works for West Hollywood with his clinician. So they are a dedicated team. So as we move forward here, you're going to see some language that says like your Met was present. That's referring to the City of West Hollywood's mental evaluation team. So on average, the Met team relieved 3 patrol deputies and 1 patrol sergeant after a scene was rendered safe, meaning that they responded, the person was able to be safely detained or de-escalated, and subsequently patrol was able to get back out to the field, and we were able to continue to provide services to that person that we were caring for. Now this is return on investment from July 1, 2018 until May 15, 2021, when we ran the numbers here. West Hollywood Station received a total of 678 calls for service during that time with persons involving mental health crisis. Your Met team, the West Hollywood Met team, was able to respond to approximately 66% of those calls, or 448 of them in the city. 375 of them were crisis calls handled by your team. 73 of them were handled by the regional teams. Now that would be our county-wide Met teams when that team was unavailable. and patrol handled 230 crisis calls when your team was on another call or off duty. In contrast, really quick, for the period of January 1, 2020 to December 31st, 2020, West Hollywood Station, if you look at these same numbers, 678 for just the 1 year period, it was 174 calls for service. And for the year 2020, it was 90% of the calls, which was 156 in the city. So it was a pretty significant number last year that they were actually able to tackle. Next slide, please. The response time for the entirety of the service for up until May 15th of last year was under 12 minutes for a response time. The regional total response time for the regional teams is 18 minutes. In contrast, for the year 2020, the response time was just under 7 minutes with our dedicated West Hollywood unit. The triage desk shows about 67 uses of force were completely averted due to the presence of the team. Also about 5 incidents where force was used, but it was a reduced level of force because of MET's involvement or de-escalation. Each incident was averted, saved an estimate of about $6,100. Therefore, West Hollywood Met has prevented 67 use of force incidents, saved the Sheriff's Department about $410,000, almost $411,000. And next slide. Next slide, there we go. So in summary, I just wanted to take a second to say thank you to the City of West Hollywood. Had some time to speak with Deputy Venegas, who made me keenly aware of the fact that the city has been a huge supporter of our MET team, specifically as it relates to homeless outreach, providing food and water, sleeping bags even, that they provide to our deputies. So when they do the outreach with the clinician, that's very unique. It's one of the only cities that is supporting the team in that way. We're very gracious for that. I'll also note the community-based organizations who have worked in partnership with us, helping us link people to services, have been fantastic. And lastly, it's worth noting, during the pandemic, we were the only responders out in the field doing outreach when others were not. And so I commend our deputies on being out there in the field, and the city staff for supporting us. We're very grateful to be serving West Hollywood, and thank you for your time.
Well, thank you. That's those numbers are very impressive, both from the Met team and, of course, from the city of West Hollywood. Now I'd like to move over to our next speaker, who is Anai Luna from Los Angeles LGBT Center's Transgender Economic Empowerment Project. Please go ahead. We'd like to hear from you.
Hi, everyone. Oh, that's perfect. My slide is all ready. So hello, everyone. My name is Anai Luna. I use they them pronouns and A in Spanish. I'm the program manager for the Transgender Economic Empowerment Project at the Los Angeles LGBT Center. And we work with the city of West Hollywood to provide services for our transgender constituents in the city of West Hollywood experiencing homelessness and engaging in underground economies as well. And so on the slides, you'll see an overview of our services and what we provide, as well as how you can contact us and get a hold of our project. And so thank you for moving. And so here we have a brief introduction of our services. And if you're a transgender, non-binary, or intersex person who is looking for support in terms of economic stability or improvement, we can help. Our project offers a wide range of services to be able to help people find their dream job, to be able to get ready for work, as well as legal services for folks who need support around name and gender marker changes, criminal record expungements, and any housing or employment discrimination. Next slide. And so, as I mentioned earlier, here are some of the services we offer for folks who are looking to seek services within our project. As I mentioned, there's a wide range of services for legal services. We also offer Know Your Rights legal workshops for folks who want to know more about their protections of rights around housing and employment discrimination. We offer survivor services for folks who are victims of crime, as well as people who are survivors of domestic violence and partner violence. Unfortunately, many of our members of the community are often survivors of many forms of discrimination and victimization. And so we do our best to be able to support them in whichever ways possible, whether that's contacting the police station to get a police report, or in just taking the very basic facts so we can help support them and gather their story together. Moreover, we have assistance around name and gender marker change, immigration legal support for our folks who are seeking asylum or refuge in the country, as well as ongoing case management and referrals for any affirming and culturally responsive resources, including job training and placement services. A lot of our network is built upon the trainings we offer with our community partners, and we'll speak more about that in just a moment. But we also offer assistance with application for opportunities and social services, financial literacy workshops to be able to get people into good financial habits so they can be more independent once they do secure employment and do secure housing, and an ongoing homeless outreach in the city of West Hollywood. Next slide, please. And we also work with businesses and agencies as well to be able to further systemic changes. So our advocacy is twofold. Not only are we working with members of the community who are experiencing homelessness, who are engaging in underground economies, who want to find a traditional workplace to be able to lift themselves out of homelessness and poverty, but we're also working with businesses to be able to offer gender diversity trainings, technical assistance, as well as inclusive policies to be able to welcome transgender, non-binary, intersex people in their workplace. And so this may look like either a diversity training or looking over a workplace manual or guidelines, or offering recommendations based off state and federal policies that are put in place to be able to protect and make sure that people are reminded that ultimately that we're all included in the workplace. And so these are some of our ongoing services for businesses. Next slide, please. And in our gender and sexual diversity trainings, here are some of the topics, which include best practices with a focus on evolving local, state, and federal laws, as I mentioned earlier, as well as the changing cultural landscape for transgender, non-binary, intersex people. As many of you know, the language and terminology is ever evolving, so we're doing our best to be able to keep people up to date with the up-to-date terms and identities that are important to be aware of, including pronouns, identities, transition guidelines, and how to create a harassment-free environment. We also offer the opportunity for culturally responsive entities who've been trained by us to be able to attend job and resource fairs that we host on a regular basis. Before COVID, we'd host them in person at different sites and locations, such as the West Hollywood Park Auditorium, or the center on Highland, or center on at the Village in Hollywood. And now we're also expanding into virtual fairs so folks can be able to access our resources and employers on a virtual digital level as well. We have an employment toolkit that's available on our website. And for more information about our services, you can go to our link here at the website, which is laelgbtcenter.org/team. Next slide, please. And if you have any additional questions, feel free to give us an email or phone call. This applies for any members of the community who are seeking services, as well as any providers who are looking to place people into care at the LGBT Center. Here is our project's phone line, as well as our project email. That's teep@laelgbtcenter.org, and 323-993-7410, and our home address, which is 118 North Macadam Place in Hollywood. We also operate out of the Koreatown location known as the Trans Wellness Center, which is a partnership between 6 different nonprofits all under one roof to provide comprehensive services for the community. And in summary, our goal is to be able to link members who are marginalized and vulnerable to comprehensive care. One thing that's not captured here in these slides, and I'll keep it very brief, is that we work alongside many of the agencies that receive funding from the City of West Hollywood to be able to offer collaborative, street-based, on the site services. And so we'll work with a clinician, we'll work with a housing navigator, we'll work with a substance abuse counselor, all in one outreach pod on the streets of West Hollywood to be able to offer on the spot comprehensive services for folks who have trouble being able to move from place to place. As you heard from the other participants and the panelists here today, that many people who are experiencing homelessness may have a hard time being able to relocate, or maybe in a crisis. And we do our best to be able to meet people where they're at and offer the services they need, face-to-face, one-on-one, right on the streets of West Hollywood. And so thank you so much for having me. I believe next we'll hear from Clifford Robert.
Yes, Cliff Roberts, we look forward to hearing from you and how Step Up on Second fits into this. Thank you.
Well, good evening, everybody. So glad to be here. And I do want to give thanks to the City of West Hollywood for being innovative and insightful enough to invite Step Up to participate in helping our open air communities, our homeless communities, however we identify them. I have one slide. I wanted to really primarily provide you information, but you can see through my experience in our program. I do want to make a correction here that my number, my work cell is 323-371-9616. You can reach out to me. We are located at 6762 Lexington Avenue in Hollywood. I began with the We Home It, which is a West Hollywood mobile integrative team, which is made up of a multi-interdisciplinary staff. We have peer specialists who have had the lived experience of homelessness. We have substance abuse counselors. We have psychotherapists, clinicians such as myself. I'm a licensed clinician, licensed clinical social worker. We have had nurse practitioners on our staff, nurses, and we also have psychiatric services. We have psychiatrists who can do evaluations and provide psychotropic medications if those are appropriate. The exception of We Home was 2016. And since then, we have housed approximately 50 plus individuals. These were folks who were successful at being homeless, who were successful at declining services. And we were able to engage them. And we do this collaboratively. We have invited the transgender economic colleagues to provide services, economic empowerment, provide services to our program, and they have done it so wonderfully. We always try to engage our diverse constituents, our clients, through a culturally competent lens, recognizing historical trauma. And we have engaged with the MET team on numerous occasions and have had amazing collaborative efforts and successful efforts assisting folks get the really needed resources, whether it be psychiatric, talk therapy, medications, and of course housing, substance abuse counseling. And linkage to treatment centers has been imperative for us. We see the relationship as being paramount. And so when we engage on the street, and we also, I like to add that we've done so during the pandemic, except for that brief time where there was really a strict lockdown, our staff were out engaging with folks in the city of West Hollywood on the streets and doing coordinated entry system packets and doing adult full assessments and various services. And we do this in a way that is very, well, normalizing to the individual's lived experience across from us. We don't assume anybody is homeless. We'll pop into the environment saying that we're here to, we identify ourselves, we step up, we are, our names, anybody that needs services, let them know that we're here. And 9 times out of 10, they'll say, I could use, and they will tell us their story. And we listen intently to their story with interest. And so I inform my staff, and I do this as well, really come from a sincere, authentic place before we go out into the field. And we take that awesome responsibility to engage with community members, that we are really going to be on track to be with them, that we're really going to be on par with them the best that we can. We're located throughout the country now. This is a step up as an organization. We're in Tennessee, we're in Atlanta, we're throughout California, we're in Florida. And I believe the reason for our success is really meeting that person where they are at, finding containment, normalizing their behaviors, going on a journey with them to really find out what has been the barriers for their reluctance to get support. We really try to have the individual mind within themselves what they need and what has perhaps been a barrier. And oftentimes it's folks are inarticulate because they've never really been asked these questions and really been listened to. I also like to think of ourselves as social therapists, in that we also are very sensitive to the unique challenges that our housed citizens have in the city of West Hollywood. Because we know that numerous folks will sleep in various garages and carports, that they'll be in front of businesses. So we are actively engaged with businesses and with security guards, because we know they often are the eyes on the street. So we get a lot of intel from various folks. I just had a conversation today where a mother called me up wanting services for her son. And so we're hoping to get that individual into Tarzana Treatment Center. And I reached out to Stuart at Tarzana. And so we really are collaborative and go through great strides to keep ourselves active with various partners. Step Up also has a robust vocational program, and where we actually have our occupational therapists handhold the individual, if you will, not just in getting prepared for employment, but once they're employed, to assist them in that successful employment, just as we would help somebody with successful tenancy. Because we notice that when people get housed, oftentimes their mental health and their substance use will actually increase, because they can engage in substance use with impunity. So we really provide hundreds of services as a person is housed. And please alert me when my time is up. I want to be mindful not to go beyond. But we have been successful for years now engaging with some of the most entrenched homeless substance users who are very comfortable with their lives as they were, being on the street, because West Hollywood is very aesthetically pleasing, amazing community where they would receive cash and food, and so they weren't really incentivized to access services. This is one of the unique challenges we have in the city of West Hollywood. And so, we would really try to help that individual be invested in their and finding their better angels, if you will. And then, in thinking about investment, I think the city of West Hollywood was very wise in bringing us into the contract for, reasons such as meeting our outcome objectives, providing a coordinated entry system, documents or tools, getting people housed, accessing, employment for some of our folks. And I do want to say that we have met several clients at the West Hollywood Sheriff's Department, where the sheriffs invited us to, Deputy Venegas come to mind, invited us, and Jackie, of course, invited us to come back into the holding cell and speak to individuals who were there overnight, and to see how we could be that nexus of care from someone who perhaps would, hoping to avoid incarceration, to actually getting some kind of access to housing. So I think I'm going to go ahead and I'm happy to answer questions. Let's go ahead and turn this over to our live comments and questions for our community members.
No, well, thank you so much, Mr. Roberts. I mean, before we get to the live comments, I first of all want to thank all the panelists so far. It is, you mentioned a concept that I think is key through all of this, and that is collaboration. It is not, these issues and problems are clearly not something that can be handled solely by one agency. It takes work across agencies, through agencies, and it's very impressive to hear this collaboration and what West Hollywood is doing. So what I'd like to do is, before we do turn this over to public comments, I want to encourage all of the panelists to respond to any questions posed by members of the public. You can jump in, I can call on you. I mean, this is not, you're not home free. You got more work to do. So that is, so that, that I'm saying that up front, and I think it makes for more productive interchange among the panelists and the community. And with that said, as chair, I have the prerogative of throwing out the first issue and question if anybody wants to tackle. Can any of you, all of you, some of you, list for us or tell us about some of the challenges with providing care in West Hollywood? You've talked about your collaboration, you've talked about work across the board with other agencies, but there have to be some challenges along the way, and how you see that those challenges can be met. So I'm going to throw this open to whoever wants to address this. Captain,
I can
go ahead.
Oh.
Lieutenant Vienna.
Sure, I'll always take a opportunity to talk about coverage, but that is a serious thing. I'm very happy to see our response times decreasing in 2020 to being less than 7 minutes when compared to 18 minutes throughout the regional teams. But that being said, West Hollywood, albeit a square mile size of small, it's a very complex area to navigate, and oftentimes we don't want to shortchange these interactions with the people we're trying to help to be able to get the linkage that they so desperately need. So I think for us, the challenge is, and I know we've had some discussions, the city and I, as it relates to potentially staging one of our county-wide teams in that area to assist in this way, to also offset those times when that unit may be tied up, but maybe if that unit is not going to a county call, they might be in the area to help with that, would be one way to mitigate it. And two, you know, some expansion perhaps in the future, if it is a success and the coverage could provide for it, to help us, because these calls are continuing to increase. And I was looking at the latest data as it related to this. And in the last 2 years, there has been the 2-year change is an increase of 36%. So fiscal year 19-20, 176 calls as we talked about, and that 6-year change, you may recall, Captain Gannon talked about the 5-year change was 159%. I'm happy to say the 6-year change is 151%. So we've decreased a little bit, but a little bit more coverage would probably help us make a little bit more dent in that, as not to have as many involuntary holds, but more linkage to services, which I think is really what we're trying to do. Thank you.
Okay, you know, you have one team, and although, as you said, 7 minutes is awfully good, oftentimes it is not. And how does this one team cover, you know, 24/7?
So he doesn't. He doesn't cover 24/7. So he has a set schedule. And I don't know, Deputy Venegas, are you on the line? Are you able to speak? I'm guessing not. So Sean has a set schedule, and when Sean is off, then our regional teams step in and cover when there's a call for service. But that's when you see that 18-minute response time. So the 7 minutes is specifically the response time for the West Hollywood unit. But the average of 18 minutes in response time is for our regional units to be able to respond. So if we had another unit that was assigned to the station, we could perhaps look at a different shift coverage time to get us closer to 24-hour coverage. So we would be available in those odd times when those calls do happen, which we never know when they're going to happen, to be honest.
All right, any of the other panelists want to address this issue? Yes, Tory.
Yeah, we have, like he said, overnight, I believe it's like at 1:30, they go dark, the Met teams. And also our deputies, because we don't have enough, we have the WeHo Met team, but we also have the county Met team housed in the sheriff's station. but about a quarter of those were not, of those calls were not answered by either of those, and it was the deputies. And what happens when the deputies answer it, if they take the patient to a receiving unit, then the hold that they can usually do is around 24 hours before they break that hold and are released. Whereas if a Met team comes and they bring that person to a receiving place, it can go as much as 72 hours up to 14 days if they choose to expand it. So in my opinion, we don't have enough Met teams, and that therefore it costs the city and a lot of those people who are taken in and are released in 24 hours, they might be a 5150 hold that are dangerous to themselves or to somebody else, and then they're released back on the street again. So we do the right thing to get them started and to get them taken to a receiving unit, but then they might get released. So I think that gives a need for more Met teams and clinicians.
Thank you. Anybody else want to address this issue?
I wanted to say something. Can you hear me?
Sure.
Okay. So I think we do have a backup plan, though it is not 24/7. We all know that Matt is not available 24/7. We have a regional team which goes from wherever they are in a west side to response to a crisis. So time does take like 17, 18 minutes. But if we really increase the Med team, responses on both side and both end, taking daytime and after hours, then there's a good solution that, we can respond more quickly and being based in the West Hollywood and provide services more readily. But again, we are talking about expanding Med, and we all know that how things goes with the expansion. We are having a hard time expanding from 33 plus, and we are really having difficulties because of the budgetary and other issues that we have, and of course, COC and public safety of West Hollywood is always supporting us, but, we need more support to really make these things happen. I mean, that's the only thing I can say.
All right, so it sounds like, at least several of you are talking about and believing that increased Met teams will make a difference in West Hollywood. So
if I could jump in really fast, if that's okay, Chair.
Just go ahead, Amanda.
Oh, sorry. So I believe that while I very much appreciate the Met team and all the work that they do, and I just want to put that out there first before I go on with my statement, I think that I often wonder why it is that we focus so much of our response with the in collaboration with the Sheriff's Department instead of with community organizations. And I think that a lot of times it's not necessary to have a sheriff's deputy dispatched. And I know that there are definitely a lot of times when it is and when there's an imminent threat, but there are a lot of times that it isn't. And so I think that we need a better system, especially in terms of dispatch, because there are plenty of times, and I often wonder about these stats and all of these calls and how it is that, from like personal experience and things that constituents tell me and community members tell me that, they can't get someone out, that someone's clearly experiencing a mental issue, but I can't call the Sheriff's Department and say, hey, so-and-so, there's someone here experiencing a mental health issue, and then they dispatch a team. So for me, it's sort of at times counterproductive to run all of these calls through the Sheriff's Department. And I wonder if there's a better way, a better system that I know that they've done in other states and other cities where we dispatch mental health teams through a different system. So I think that that's definitely one of the challenges we face. And also increasing the Met team, of course, is very important. Increasing the times and increasing the amount of people what we have. But I think that in the end, it comes down to there are so many people experiencing mental health issues that aren't criminals, and they get themselves into situations that do become criminal or disruptive, and it's hard to deal with when we don't need a sheriff's response.
Thank you for that, Amanda. I mean, that is certainly a perspective that a lot of communities and individuals feel very strongly about. And I guess sort of as an addendum to this, does anybody, I mean, this is kind of we could spend hours talking about this, but does anybody have a feeling as to why the need for services has expanded so much? I mean, I've read numbers of articles and listened to people talk about all sorts of things. And I wondered if any of the panelists had any thoughts as to why these numbers have been increasing so much.
You know, if I may speak.
Tory, please.
What?
Okay, this is probably going to, maybe Clifford can answer this. We have something that I found really interesting. I got some facts on this morning. We have something where the Tarzana Treatment Center, they have an MOU with our Sheriff's Department where they can go in to the jail and interview the people who have been involved with drugs. And they have the choice whether they can go into treatment for 30 days, and then our sheriffs will try the best they can to eliminate those charges that were against them. And we had about 10 to 15 interviews. Now this was started before COVID, so COVID could have affected this, but the majority, only a couple of them qualified for this system, and of those, they chose not to go into treatment. And so I thought that was really surprising and interesting as to why those people aren't choosing to go into treatment and they go to jail. And I thought about it later, and Sheriff Villanueva had come to West Hollywood, and he spoke and he said, on average, if a person gets a 6-month jail sentence, they will spend 1 day in jail. Anybody, you guys can check that, pipe up about that, but if that's true, then why should a person choose to go into 30-day treatment? As I don't know. I just thought that was really surprising and interesting. So that may have something to do with it.
Okay, thank you. That very well may have something to do with it. Cliff, did you want to jump in here?
Yeah, thank you. We're at the little hand wave there. So I think part of it, I think everything is connected. And Amanda, thanks so much for bringing up, because I'm really the issue of mental health. We're hearing more about police making progress and remarketing themselves and having these vet teams are wonderful. But I'm really happy to say that we have not put anybody on a hold. We really try to avoid putting someone on a hold, unless, of course, we're mandated to, which they're danger to self or others, or it's gross neglect, self-neglect. And we try to avert that at all costs. I think you cannot separate the fact that we've had be very transparent here, hostile administration these past 4 years. And the message was very loud and clear to underserved and marginalized communities that they were not part of the American family, that there was a lot of hostility towards individuals who did not fit a very narrow mold of what it means to be a human being, to be, as far as representation. So I think that's part of it, a big part of it. And that does trickle down to local entities. Fortunately, the city of West Hollywood is an exemplary city that's innovative and has invited, nonprofits such as ours up a second to come in. I also think, of course, the pandemic really has exacerbated pre-existing mental health. And folks have told us that. So where we could really sit down with somebody and do a CDS packet, we found this past year that folks were extremely anxious, and it was really difficult for them to be focused with us. So I think there's a number of other issues, and at some point maybe we can speak to this, and then I want to receive back here for a moment. But I think when we're talking about, because some of you have mentioned budgets, and we're working with county officials here, I think someone else mentioned about the system really in need of repair, is that I would be remiss not to say that particularly our nonprofits, we need to have a way to really incentivize folks to stay with nonprofits, to really be incentivized to choose working with nonprofits and community mental health, and by way of compensation. And that is something that really is not really given voice to. And I really have tried to be an advocate of that, because we really never hear anybody bring that up. And so I think we really need to bring that into the equation if we really want to pull in the best and the brightest into community mental health, just like we do with tech firms, right? So I think that's an important thing that we ought to look at. Thank you.
Thank you all for that. And I think we now will go to hearing questions and comments from.
Lael, this is Commissioner Harris. I believe Eden is trying to get in on this conversation, but he's waving his hand and you're not seeing him.
Oh, okay. Sorry. Thanks.
That's okay.
Thanks,
Sure.
TP. We missed you earlier.
I understand. Well, I'm here now.
Okay. Welcome. One of our commissioners on the commission. Eden, I'm sorry if you wanted to weigh in on this before we go to public comment, please do.
Thank you. I do appreciate it. And thank you so much, JP, for flagging me down. Just as a correction, I use they, them pronouns, so please they, them when referring to me. But briefly just speak to both of those questions earlier. I think there could be a number of different reasons that could be a factor for the increase in numbers, but ultimately, I think the challenge and the bottleneck here is that there's not enough jobs and not enough houses to be able to effectively move everyone off the streets. I think that's kind of the challenge that we're trying to work with shelters and employers to be able to offer those opportunities for our community members. And that's compounded by the numbers of hostile workplaces and hostile shelters that we have available for our trans and non-binary and intersex community. And so much of that work has to be done internally in that cultural shift. Even though the agencies may be on board, the culture, the folks they're living with, their coworkers, the people on the ground who don't have access to that information still have so much to learn. And so it's going to be a long shift before we can really fully integrate members of the LGBTQ plus community at large into workplaces and into housing facilities. And this is only exacerbated by the pandemic right now with record numbers of unemployment and poverty and houselessness as well.
All right, thank you. And I apologize for not seeing you up there. So now, Jennifer, would you go ahead and start the public comment, please?
Sure, and as a reminder to all of the attendees, if you would like to ask a question to the panelist or make a comment, please open up the participant window and click on the small hand icon. When it's shaded in gray, your hand is raised. And otherwise, you can also send a chat to the host and we'll make sure that you're on cue. And before we take our first commenter, we have one quick announcement in Spanish.
Buenas tardes. Si necesita que sus comentarios se traduzcan, simplemente diga la palabra español antes de comenzar a hablar y alguien le dará instrucciones para proceder con sus comentarios. Gracias.
Thank you. And our first comment will come from William, get this right, William Siegmiller. William, you're unmuted now. Please go ahead with your comment or question.
Okay, thank you. Yeah, so Luna's comments are so prescient, and I hope everyone can value them. And just from my own perspective, my name is Wes. I work with marginalized communities in West Hollywood locally and in the region. From my perspective, what's increased need is, apart from everything else, is obviously the lockdowns and the business closures. And what that did is it disrupted the usual drug supply chain. And so fentanyl really that problem really was exacerbated, where we're finding it in all sorts of, drugs that typically you wouldn't associate with, like amphetamines. So it's just a crisis in the community. And my actual comment is, at the height of the lockdowns, the CDC actually released guidelines that prohibited encampment sweeps of homeless people because of the public health risks, but also they cited specifically that it disrupted outreach workers, continued communication with the people they're tasked to serve. And with what's happened in MacArthur Park, we're all really closely watching, or have even been personally involved in how these things are playing out with the outcomes for the homeless people that we're trying to center. So like Ms. Rubin said, solving this crisis is going to require multidisciplinary reform. So my specific question to the Met is, can you speak to the impact of homeless encampment sweeps on your ability to maintain contact with vulnerable unhoused people that are displaced by them? Thank you so much.
Thank you for that. Boy, you came right on with a critical question. So Captain Gannon or Lieutenant Vienna, you want to address that to start off with?
Sure, I'm happy to address that. So the homeless encampments are challenging, and it's very important as we work with those folks to try and get them to appropriate linkage for services that we do keep track and try and do follow through. The Met Teams has our risk assessment monitoring program, RAMP, and our RAMP program does a lot of case management and follow-up. So every time one of our deputies goes and contacts somebody in the field, they complete a contact sheet, which subsequently leads to additional follow-up to be done. So we can make sure both from the mental health side, working with our partners at DMH, as well as from our own side with our RAMP folks, with our RAMP case managers, that they're able to go ahead and follow this person as best as we can to get them to a successful outcome. That being said, most recently you may have seen our RAMP folks in Venice. And that had been publicized, I think, last week as we were doing outreach with our homeless outreach and services team that works with LASA and DMH to try and do some outreach and placement. It is important to us, and it's important to the sheriff, that we do that outreach in a way that is humane, and he views it as a humanitarian effort. So that being said, he asked the Met Teams to assist and have clinicians present because he understands the underlying mental health issues that sometimes can plague our homeless populations. And so we're doing what we can to do that. But in summary, RAMP is our answer to doing case management and follow-up in a meaningful way for successful outcomes. Thank you.
Anybody else want to comment on that? I wonder that, that in sort of the unspoken, one of the unspoken issues is what a sweep would do in terms of dismantling homeless encampment. And I don't know if there's anybody who has addressed that issue. Lieutenant Vienna, you want to try that one?
No, Madam Chair, I do not. But I will say this: Lieutenant Jeff Diedrich, he's my counterpart here at Community Partnerships Bureau, and it may be helpful, perhaps at another session, to have Lieutenant Diedrich on the line here. He is an institution of knowledge for the last several years, working jointly with LASA and all of our different offices at the state and local level to do homelessness outreach and work with the folks. And again, it's more outreach than it is sweeps. We really try not to do homeless sweeps, but we do work to do a lot of homeless outreach. And I would defer to Lieutenant Diedrich. I don't know, Captain Gannon, if you'd like to take a stab at that, but that would be my thoughts.
No, I would agree with that. We are merely a component that's out there to address the underlying unmet needs of these folks. And keep in mind, your Met Teams are really there for the acute crisis that we encounter in the field, and then they return to service to address the next. They're subject to call, and that's what they do every day. We count on our providers that we link them to then provide the correct, prescription or prescribed care, if you will, and follow that protocol. But unfortunately, many of the of the prescribed treatments are voluntary, and a lot of people just walk out once the time expires, and we're back into the same cyclical nature of these chronic concerns that we're all seeing.
I'd like to hear from David Juni, General Services Manager, West Hollywood. I think you had a question or wanted some input, and I'm sorry if I missed seeing that you wanted to respond.
No problem. Thank you, Chair Rubin. I was just curious with the presentation from the sheriffs with Lieutenant Vienna with the numbers for calls that required the Met to respond. Do you have a percentage of how many of those were for unhoused community members and how many were for housed residents?
I do not have those numbers.
Sanjay,
readily. I think Sanjay had those.
And I just wanted to say that because bringing the Met on has been a benefit to the community as a whole. But I also want to give a little context for the communication that many of these calls are also for our housed residents who are having mental health crises. The city has been working, I'm the manager of the city social service division. The city has been working for a number of years to collaborate and work much more closely with the sheriffs. Our sheriffs truly are invaluable, and having the dedicated Met team truly has made a big difference. I know the city is looking at potentially trying to bring on another Met team dedicated to West Hollywood. We certainly appreciate them, but I also want to mention that through our contracted agencies, we've also increased that presence on the street, increased the amount of programs that are available for community members, and really have tried to provide services that target our most vulnerable community members. We have about 10 different contracted agencies that are on the street that have street teams, and it includes a number of different target populations. Luna has mentioned the work that TEEP does with our transgender community. We brought on this last funding cycle the Trans Latina Coalition, which also has street outreach workers targeting our vulnerable trans community members. We have APLA Health on the street with HIV specialists. The number of community members unhoused in West Hollywood that are living with HIV is much higher than the county as a whole. We know that all community members are at risk for HIV. So the city has been working towards really getting more presence on the street and working even closer with the sheriffs. But I thought it would be a little good to have some context with those percentages of calls for unhoused and for housed community members.
Thank you for that. I think that was very helpful. And again, then I raised the issue of what kind of collaboration is there among all of these significant groups that are out there. I think, Amanda, did you want to weigh in at this point?
No, I think I'm okay. I think that I just for me, I think it's more of when we talk about homelessness in LA and we talk about the sheriff's department and the involvement and the Met teams, I feel like we sometimes forget to separate that we have our homeless community and people that have fallen on hard times and people that are experiencing mental health issues, and then we sort of have our transient community that are causing a lot of the crimes, and some of them are also experiencing mental health and substance abuse issues. And I think that it's really important when we're dealing with this issue that we look at it sort of on a separate basis in those two categories as well as a whole picture.
Okay, great comment. Jennifer, let's go to the next public comment, please.
Sure. And next we have Jordan David. Jordan, you are unmuted. Please go ahead.
Hey, can everyone hear me?
Yes, we do.
Great. When it comes to the West Hollywood Sheriff's failed response to homelessness and mental health, it's difficult to choose a story because there are so many. The Sheriff's Department is incredibly racist and classist. Their efforts are focused on terrorizing Black, Indigenous, and people of color, along with anyone who's poor or unhoused. Mental health crises are escalated when they arrive and result in more violent and deadly outcomes. I'll never forget when I witnessed at least 10 deputies pull up behind one unhoused Black man in a parking lot on Santa Monica and La Brea. I was there long before them and observed the entire interaction. Although the man had not committed any crime, the gang of police threw him to the ground, hog-tied him with zip ties, and drug him across the parking lot. He never resisted or showed any signs of hostility and had no weapons. As they drug him across the pavement, his only belongings and clothing began to fall away. Eventually, I yelled at them to at least come and get his shoes before driving off to cage him. On top of brutalizing and falsely arresting him, they were going to leave behind the few items and clothing that he had left. Several other bystanders said something as they went by, and the officers threatened us and told us to leave, even though everyone had kept their distance as to not interfere. They just didn't want to be filmed or have witnesses. Another time, when the mask mandate was given to police, I watched them allow rich white people to enter stores maskless and give out tickets and harass Black people that were masked. It was just used as another excuse to send the message to BIPOC people that you're not welcome here. I've watched unhoused people ask cops for help and resources only to be turned away. I've watched them pull over brown families with children and elders on the way home from dinner, humiliating them as they're forced to show their bodies in the middle of the street to prove that they're not in a gang. Knowing the well-documented violent deputy gangs within the sheriff's department, I want to ask every officer on this call, show us your tats. Prove that you're not in a gang. In conclusion, police have no place interacting with any unhoused person and are unfit to solve any mental health problem. These issues need to be removed from their purview immediately so qualified professionals can handle them instead. Thank you.
Thank you, Mr. David. Before I see if there's anybody on the panel that wants to respond to this, I would like to ask our executive director, who is on the call here with us, to have a staff member contact Mr. David to get more information and take a look at some of the issues that he has raised, because I think that they're significant. With that said, is there anybody on the panel who wants to jump in after Mr. David's comments?
Well, I'm happy to just say for the record that I have no tattoos, and I don't want to give too much of revealing here as much as I can. But in all seriousness, you know, I do think that most of the deputies, if not all of the deputies, in the short time that I've been at the mental evaluation team, all are here with compassion and with heart, working with their clinicians to do this job and to work collaboratively with the community to be able to do this job. So I'm very sorry for that experience that the gentleman laid out. But to that end, I just want to say I'm not in a gang and I have no tattoos. And I'm happy to invite anyone to come inspect. Thank you.
Anybody else want to join in on this?
Yeah,
I have to look at the data. The data shows convincingly that MET has consistently, for the past several years, has consistently saved and prevented the loss of life, let alone the loss of injuries through potential uses of force. Just last year alone, 2020, because MET units were arriving in time to change the trajectory of the incidents, 434 uses of force were averted. And I believe in my heart that every person in patrol wants that positive outcome. You know, contrary to what may be said in the press, I've never met a deputy sheriff who wanted to hurt a mentally ill or developmentally disabled person. There's no honor in that, and I don't think anybody wants to see that happen. So I see a department that's embracing MET and wants more of this. We want to arrive in time and have this expertise available on scene so that we can help de-escalate these incidents. I can't speak to his specific incident, but I can tell you that last year alone, of those 434, 35 of them were people still wielding deadly instruments or implements when MET arrived, and those 34 wanted suicide by cop. Every single one of those was averted, not one resulted in a shooting or a death of the patient. So there's a lot more good news than bad. You just don't hear about it because it's not newsworthy.
I wanted to add.
Go ahead, Amanda.
No, that's okay. That was just me moving my hand. Sorry.
Anybody else want to jump in here?
Yeah, can you hear me?
Yes, go ahead.
Okay, this is Sanjay. I'm the manager for the Department of Mental Health MET team. I've been working here for the last 5 years, and I will tell you, not a single incident that happened in a death or a shooting to a person. Only exception could be when there is no MET involved. And I wanted to just go on record and say that this is true because I have been a witness for the last 5 years here. I've been working for the Department of Mental Health for Los Angeles County, and my team works side by side with the unmarked car, with the deputy who is not in uniform, working with mentally ill. And I'll tell you one thing, there are clients, there are people that we need a MET team to respond. The reason for that is there are times when the psychiatric mobile response team, which is the civilian team, cannot handle the cases. People with the guns, people with the weapons, people with the increasing violence, people with escalating aggression, people who are really wanted to hurt their family member. These are the cases that a psychiatric mobile response team, which is the Department of Mental Health team, cannot handle it. And we have a MET team who goes out there. They work hours and hours to de-escalate the person and trying to work with the family and the neighbors and the client so that they can cooperate and trying to work with them. I have seen a lot of disengagement that is happening in the community when the person has been barricaded. But we also follow up with our RAN team so that they can follow up and see if they can link the person to a mental health services when they are at the right time, at the right place, when they are willing to negotiate and talk with them and trying to get some help. So I think there is a two side of the story, and I'm not working for the sheriff department. I can tell you that. I don't have any tattoos. I don't have any people who are working here who are gangbangers or people who are having that kind of an affiliation. So I work with a clean, nice, professional people, and I wanted to attest to that. Thank you very much.
Thank you. I think at this point, Jennifer, let's go to the next public comment question, please.
Sure, and the next one will come from Jessanisa Malburn. You are unmuted. Please go ahead.
I told you to give me a count of the men.
Jessanisa, you are unmuted. Would you like to make a comment?
Hello?
Yes, Jessanisa, you're unmuted. Would you like to make a comment?
Thank you. Can you hear me now?
Yes, please go ahead.
Okay, so I am a case manager. I'm actually a neuro-linguistic programmer, and I work specifically with the homeless starting in Skid Row since 2013. And we actually work with Project Roomkey from the very beginning to house some of our clients. When we did so, we had, I believe on scene, a Officer Dietrich was his name, with LASA. And they stated because I was African-American caseworker that I wasn't on the list to house people in Project Roomkey. A week later, they took my picture on the scene, and this was July of 2020. A week later, Lhasa and Dietrich posted a flyer with my picture on it stating, "Attention, please be aware of the security issues we have faced with this individual who is housing people in Project Roomkey without authorization." I am currently fighting this case because this is defamation, it is slander, and I echo the sentiments of Mr. David, I believe, that was speaking earlier concerning Guigny. I'm sorry if I butchered the name, but he stated exactly how African Americans who are being mistreated, not only as houseless clients, but as case managers, as nonprofit organizations who do have solutions to homelessness. But because there is a bureaucracy with LAHSA, they only work with the people that they like. Not only do I find it insulting that I have to walk up my block where I see needles and homeless encampments growing along the side, but we are prevented from even having our plan of action recognized. So I want to know from the officers that's on this call, why is it okay for Officer Dietrich to not only slander a qualified caseworker who's also a doctor to help mental health just because they're not part of the good old boys club? How can we rectify this situation? And second part question is there empty property, lot, city-owned property in the city of West Hollywood? I don't know if we asked the mayor or if there's someone that can direct us to that so we can actually build a mental health access center. And I believe Mr. Sanjay from DMH, Dr. Jonathan Sharon also, who is a good friend of ours, we want to extend these services the right way without hindrance or discrimination. So that's part of our testimony of what we're facing right now. And if tomorrow we can get a letter of apology from Officer Dietrich for this slanderous post that's still in every homeless shelter in LA County, we just need explanations and answers. Because we are a nonprofit organization with a group of mental health professionals, peer specialists, lived experienced people who want to give back, who are looking to really solve the homeless crisis. But behind the scenes, there is this type of discrimination that not only is being swept under the rug, but it's insulting the intelligence of qualified homeless outreach providers. Thank you.
Thank you for that, Ms. Malvern. The second part of your question might be a little easier to respond to, and that is for the West Hollywood people. Is there vacant property or land that the city is considering building, leasing in terms of housing for homeless and other people who need assistance? So I'm throwing that out to somebody from West Hollywood. Yes.
So it's perfect timing up from the previous caller. There's an item on the city council's agenda on Monday night to get into a contract with a consultant to identify a location in West Hollywood, ultimately for an access center. So to have a storefront location in the city to bring in our contracted providers and collaborative providers to provide services to our unhoused community members face to face. That'll be on Monday night's agenda. You're welcome to come and speak under public comment. So good timing. Thank you.
Thank you for that. Anybody else want to address this issue? It sounds like, Ms. Malvern, that you may be talking about something that is not in the city of West Hollywood, that is in the city of Los Angeles, which is a whole other bureaucracy, if you will. So if in fact it involves the city of Los Angeles, I don't know that there's anybody here who can address that issue. But I thank you for raising the issue, and will be interested in following what the city of West Hollywood does on this issue of an access center. Jennifer, the next comment, please.
Sure, that will come from Karen Aris. Karen, you're unmuted. Please go ahead.
Hi, thank you. My name's Karen Ayers. I'm a 20-year resident of West Hollywood. I also serve on the Rent Stabilization Commission, but my comments here tonight are as a private citizen. I found what Tory was saying earlier really compelling about how he found out that when people with mental issues are detained by the police, the deputies will often ask them or give them an offer of mental health services at that point. And Tory said that he was told that very rarely do they accept that offer. And I was just wondering, well, it leads back to what Chair Rubin was saying about collaboration. This might be a good opportunity for the deputies to call in someone from Step Up or from someone from the center to come in and make that offer. I think the choice or the option of treatment should come from a social service worker and not the police. And I think, you know, even though I know the police are trained, I think a lot of the people who are experiencing mental issues cannot get past the uniform. And as far as trusting what the person has to offer. So I think that an offer like this might be more effective coming from somebody from Step Up or the center or someone, some other social services who is more practiced at this kind of outreach and can answer questions about the kind of services that are available and perhaps get that trust. So I'm wondering if there might be an opportunity for this kind of collaboration where the deputies could call in people from the social service agencies to make those offers to people who are detained. Thank you.
Thank you for that. Really, really good inquiry and good comments. Cliff, do you ever go into the jail when somebody is detained and in custody, at least for a period of time, to explain what services might be available?
Yes, and that was a great question. Thank you. I have, and I think I had mentioned that historically I've been at the West Hollywood Sheriff's Department and back into the holding facility and spoke with individuals and really starting that rapport building and giving them our contact information and letting them know that we're available and that we really want to support them and assist them. And I think when people hear that we are particularly social workers, I may be a little bit biased, but it seems to really disarm people and people feel safe with us because we have a history in the world actually of working with those those underserved, marginalized communities. So yes, I've been there. I will continue to go there. You can reach out to me or my staff, which are a microcosm of the greater communities. We are made up of all different folks as far as racial and orientation and identity. We're happy to go out and help the sheriff that we can. Thank you.
I'm going to ask the same question to Eden. Have you found yourself in a situation where you or the people you work with are called into West Hollywood Station to have a conversation offering services to somebody who's been detained there?
Not in the station as often, but we do work with Deputy Venegas to be able to offer services on the streets, on the spot. And so we will work with Deputy Venegas either on the phone or email to be able to rendezvous at a certain park or a certain street to be able to offer additional services for folks who are experiencing homelessness. I think, as we mentioned earlier, some of the challenges are responding 24/7. Right now, we're a team of 1.5 staff. And so having a person there at 3 a.m. in the morning or 7 a.m. in the morning can be a challenge, especially when many of our clients that we meet are active and ready for services in the afternoon or late evening. And so it's an ongoing challenge in being available 24/7 and also having available beds and shelters and opportunities for people to be able to find work. So it's an ongoing capacity issue, but we're always there and available when Deputy Venegas needs us, as well as in our routine outreach hours as well in the city.
Thank you. Deputy, yeah, I'm gonna call on you in just a minute, Mr. Juni. Deputy Venegas, are you still on? Do you want to weigh in? I don't know. I had seen your name earlier, and we haven't had a chance to get any comments from you.
Yes, I'm here.
Yes. You want to weigh in on this, please? Thank you.
Every day I talk to the jailer and see who's in jail, and I try to ask them for services, if they want housing, any kind of mental health issues they need, and I'll try to refer them to Step Up 1 Second, the Sensa, or even Transgender Treatment Center.
All right, Mr. Juni?
Just for clarification, the MOU that Commissioner Berger referenced and that the public speaker Karen mentioned, the MOU is between the sheriffs and Tarzana Treatment Center. And if someone has been detained at the sheriff's department, they contact the outreach worker from Tarzana to come present the programming to them. It's not from the sheriffs, it's from Tarzana.
Oh, thank you for that. That's great. But I take it Tarzana Treatment is the only one that is currently contracted with the sheriff. Is that correct?
They're the only agency that's in this current MOU. We have other treatment providers. Tarzana has the full range of programming from inpatient detox through residential, through transitional or sober living.
Thank you. I've known of their work for many years, and they do great things when they're brought in early enough. Anybody else want to weigh in before we go to the next public comment? Jennifer?
Yeah, I wanted to say something about the training of our MET clinician. They are trained in a de-escalation as well as not to, put the people in an incarceration situation. So they're trying to explore every avenues, including homelessness, substance abuse program, or domestic violence, or any other type of program they can get help from. And they're trying to connect the persons for those services so that they don't end up in an incarceration situation. So that is our motto of our program. So I just kind of wanted to tell you, and every day, clinician and Deputy Venegas goes to the West Hollywood watch commander and basically ask for if they need any help with any jail client that has a positive for mental health or anything of substance abuse in nature. So that's the way how we operate on a daily basis. Thank you.
Thank you. Anna Marie, I'm sorry, Annadennise Briz, you want to weigh in at this point, and I'm sorry I didn't call on you sooner.
And I think you're on mute.
And it does look like, Annadennise, that you are unmuted, but we're still not able to hear you. If you have a Microsoft Teams or a Zoom application, please go ahead and close everything else. And if that doesn't work on the back end, we can chat and I can walk you through a few additional options.
While we're waiting for that, let's go to the next public comment and then we can circle back to Annadennise.
Sounds good. And the next comment will come from Sage Johnson. You're unmuted. Please go ahead, Sage. Not hearing anything. Again, Sage Johnson, you're unmuted. Please go ahead. Okay, go ahead and chat me on the back end as well. We'll move on to Dimitri Kermani. You are unmuted, Dimitri. Please go ahead.
Good evening. Can everybody hear me?
Yes, we do.
Oh, fantastic. First and foremost, I want to thank all of our law enforcement that are on this call from the Sheriff's Department. I think you have all done an absolutely outstanding job in the city of West Hollywood. You make us feel safe, you make us feel protected, and I know on many occasions your hands are tied. So thank you first and foremost for continuing to protect and serve our communities. I think as a member of the public, it's very hard for us to really empathize and understand the challenges that you face on a daily basis, what you go through in terms of the dangers that are sometimes presented and sometimes not, and the split-second decisions that you have to make. So, seeing that increased response time and how you have effectively worked with the homeless community in your outreach program and the MET program, hats off to you. And my question is directed towards the members of law enforcement on this call. How can the public or the city essentially provide you with additional resources? What are the resources that you need in order for you to be able to better serve the community's homeless population? And, I know that we've been discussing a lot what it is we would like to see, but I think it really starts with the sheriff. I mean, you're the first point of contact with these individuals, and I don't think there's anybody better to address how we can provide further resources to you, so to further de-escalate situations, whether it's not just increasing the Met team, but are there additional things we can get to you that would help combat this crisis that we're seeing on the streets today?
Thank you for that. That's a great question. Captain Gannon, Lieutenant Vienna, do you want to weigh in or respond to the question, please?
Well, first, thank you for that positive comment. We really appreciate it. And people on these teams and teams like ours work very hard day in, day out. They're dedicated and usually have been touched by mental illness and developmental disabilities within their families. So it's very personal to most of us who do this job. What we really need is, just the continued pressure to help fund us fully. It's very difficult to do this job with only 55% of the resources, like having one hand tied behind your back. Nothing hurts more than to realize we could have probably stopped a person from getting hurt, let alone getting killed in an encounter with law enforcement that could have been prevented potentially if we had had enough Met units on duty at the time. And unfortunately, we've had to struggle with that recently. It's just a fact of life. We don't have enough. And we certainly would appreciate the support from the public to help our political leaders realize that we need to finish what we started. We know Met works. We know very well that it helps save lives, but we just need to fully fund it.
And
go ahead. Anybody else?
Sure. Lieutenant Vienna, number one is thank you so much for that comment. And uniquely, what you stated, how you can help is a pretty loaded question because, for my deputy who's out on the streets, I can tell you the city giving him food and water and a sleeping bag in the early morning hours when he's out there by himself and with his clinician and may or may not be able to get a phone call to a community or faith-based organization to help is very much valuable. So I commend the city of West Hollywood and its leaders, the city council and the city staff for what they're doing. And I commend you for being here on this call right now. And my advice to you would be to continue to be involved, both as the captain outlined in terms of public comment, but also to get involved in your city or with a community-based organization that also supports these efforts, because it is those efforts that materialize into just some of the things that maybe you don't think about. And one last thing, and Amanda talked about a little bit earlier, is in the near future, instead of calls for mental health crisis going to 911, they may go to 988. And when that happens, you might see a lot of folks hearing from the psychiatric mobile response teams from the Department of Mental Health, depending on what level of crisis those people are, which would actually divert law enforcement responses, except for those in an acute crisis that would prompt law enforcement response, which would be deemed a level 4 or higher in the way we're talking about it. So I bring that up only to say that in those times of need, it also will be important for public support to be able to find those places where sometimes law enforcement intervention may be requested at times when those teams at lower levels may not be able to handle those calls for service. And so really understanding the whole spectrum of the interaction from the beginning to the end is critically important as mental health crisis response continues to evolve. Thank you.
I'm so glad you mentioned 988 and where those calls go. Do you know when that is going to come online?
I'll defer to Captain Gannon as he's been spearheading some of that.
So it will go live next summer, July of 2022. But in LA County, we're already taking steps to categorize crises that are received so that we can uniformly classify them and move them to the proper agencies to handle, so that not every crisis will automatically be handled by law enforcement. So we won't wait for 988 for that to happen. That'll happen later this year. We're already working on that.
That's great. I think I got word that Annadennise Briz now has the ability to have some audio. So if you want to weigh in, we welcome that. Thank you.
Yes, thank you. Can you hear me?
We do.
Okay.
Wonderful. I just wanted to remind listeners and everybody that's on this panel, the Met team is not regular patrol. We do not respond in uniform. We have partners that are Department of Mental Health licensed clinicians. So we have somebody with us that is not quote unquote police. The great thing about having your own Met team in West Hollywood is that team becomes extremely familiar with the services available in the city, in that area, and throughout Los Angeles County. And I can say firsthand that I know that they do collaborate with the agencies in the area, which is great because they become familiar with the city and everything that is offered to the city there. Along with having met their ramp is part of it. And so when you do get those folks, as Lieutenant Vienna mentioned earlier, that are higher risk, that are high utilizers, ramp then comes in and we do intensive crisis stabilization, which includes intensive case management, and truly work together with agencies to get the much needed help and resources to help the most seriously vulnerable mentally ill folks in the city.
Thank you for that, and reminding everybody that what the Met team looks like when they come out. I want to circle back to Captain Gannon. You mentioned that you're not waiting until 988 goes online in July. You are working now to get something in the works, and if you can expand on that, I think that would be helpful.
Sure, that's referred to in LA County as our effort for alternative crisis response. We're looking at the way we collectively, all of us, all in the business, if you will, who respond to mental health crisis in the field, how we can better coordinate, how we can uniformly communicate about the types of crises we have, and how we can ensure that people who need help, no matter what touch point they have with our system, will be properly routed to the proper level of care, such that law enforcement isn't going to all of the crises that you may be concerned about us over responding today, for example. But in the future, we hope to have more PMRT teams that can respond 24 hours a day as well and take some of that workload as well. Nonprofits and other agencies that can work. An example, by the way, of nonprofits and other entities working with us for the calls that we don't need to handle as law enforcement is the Veterans Peer Access Network, or VPAN. And VPAN responds with clinicians and peer support counselors to take over where maybe somebody's been encountered in the field, but they don't meet criteria for a hold. They need some level of care and they're a veteran, and it's a warm handoff to someone who can help take them to the next level of care without law enforcement having to be involved every step of the way. That model is similar to what we're attempting to replicate here in LA County, even for non-veterans. So we'll have care across the spectrum. That way we'll focus only on the crises that involve either reportable crime that we're mandated to investigate or a public safety threat to some other person, not just the client themselves. Those will be the criteria for law enforcement to have to be involved.
Thank you for that. That's very helpful. Jennifer, the next public comment, please.
Sure, that will come from Danny Roman. Danny, you are unmuted. Please go ahead. Danny Roman, you are unmuted. Please go ahead with your comment. Okay, looks like we are not hearing from Danny. We will move on to the next one, which is Anna Davidson. Anna, you are unmuted. Please go ahead.
Hi, can you hear me okay?
Yes, yes, we do. Please go ahead.
Hi, so my name is Anna Davidson and I'm the Homeless Services Advocate for Ogden Police Department here in Utah. I've been building this program and I'm based in community policing with one specific officer assigned to me. As I build this program in my area, I deal with chronically homeless, mentally ill mostly. What advice can you give me as I build this program that I can take back to my department and utilize to better assist? I am part of our local homeless coordinating committee for the state of Utah in our area as well. So I do coordinate very well with our shelters and our other nonprofits. I'm just trying to bridge the gap between law enforcement and citizens and getting people to see that cohesive middle ground. What advice can you give me?
Well, that again will take another few hours, but Captain Gannon, you want to weigh in at least somewhat on this?
Yeah, I mean, there's a whole host. You might want to contact us offline. We have multiple police departments and agencies, especially Northern and Southern California, who come and work with us for a couple of days. And we're able to show you how we basically embed some of our personnel with the homeless outreach efforts so that you're able to address the unmet needs for mental health and substance use disorders at the same time when the social work agencies are there doing their outreach. And in our area, it's LASA generally who's doing the outreach. And we have different specialists who work in that area. You heard about Lieutenant Diedrich. His team is very unique, the host team. So I would suggest, again, maybe touching base with them and spend a day out here with us if you can.
That would be incredible. It's a great program, and I think I can benefit the community if I do it correctly. So all the advice I can get from other agencies doing things. I do have CIT training, and I have a degree in social work as well. So that definitely assists me in bridging this gap. Is there a way to get your contact information?
I'm going to put my email address in the chat right now, and you're welcome to reach out. I'll connect you.
Okay, thank you so much.
Thank you for that, and thank you for that, Captain Gannon. So we are coming to the end of our time here, and I want to just give anybody who on the panel who has in a minute or two to to sort of summarize where we are, what your thoughts are as a result of this discussion and the comments from the public. So anybody want to weigh in on that, please do. Yes.
I would like.
I can actually weigh in really fast. I'm really glad that we did this, and I'm happy to have been invited and glad to have been a panelist. I'm really excited about the news about the 988 line, which was one of the things that I really wanted for the community, and I've been asking for sort of something like that for a while now in public safety. And I love hearing comments from the public on things that, because we don't always get a lot of comments at our meetings. So I like being in a different environment and hearing comments from the public that I could take back and absorb into future meetings. So thank you very much for inviting me.
Thank you for being here. Tory?
Yeah, I would like to comment on the concept of using something like the therapeutic transport vans that's in prototype right now. It's a pilot in LA City where they don't send out a law enforcement with them because there's not really imminent danger for a law enforcement person to be there in uniform. Also, I'd like to comment on the use of a clinician in cell extractions in the sheriff's station. We have an 86% success rate for cell extractions when a clinician goes and speaks with them, and therefore we don't have to bring in a cell extraction team or have the other kinds of problems. And I've had some people ask me, how does dispatch work in West Hollywood, when does a MET team get sent out? And is it just the normal dispatcher that determines if a MET team is going to get sent out or not? And the answer to that is our MET team is there monitoring all of the calls. And so they can determine, okay, this looks like a mental health crisis. And they can then go out on those calls. And the last thing is of the teams that have gone out, our fire department actually in back in March when we had the Met team report, they were saying we didn't have the ability to take the patient somewhere, like the urgent care centers. And I was able to contact Dr. Sharon, the director of DMH, and he said that that now has changed and that we can now take them directly to urgent care centers. And I thought that that was a really important thing, but we don't have enough urgent care centers. There's just a smattering of those now. So it's on the right track. And thank you for being here for this. It's been excellent. We have a homeless subcommittee with our city council. They are working on things, something like Cahoots in Eugene, Oregon, or the therapeutic transport van kind of an idea, so that we don't have to send out our officers when a clinician is better to send out. Thank you.
Thank you for that. I just want to tell everybody again, thank you very much for your insight and your thoughts and your participation, and raising lots of issues that are out there. And again, I circle back to the importance of working collaboratively to work to solve some of these issues. I also want to thank members of the public for sharing their views and tuning in this evening in this important conversation. To stay informed of upcoming meetings and events, please visit our website, coc.lacounty.gov or weho.org. The next Sheriff's Civilian Oversight Commission meeting is this Thursday, June 17th, from 9 to 1. That information is up now, and we welcome any or all of you to come and participate in the meeting. Thank you all again, and stay safe, and hopefully we'll see you live sometime soon. Good night.
Night.
Thank you.